All right, we're all set. Pam, what's going on in your world?
Well, we did have a little bit of a COVID surge last month, which we'll be getting our snapshot out in the next week or so. So we'll kind of give you some numbers on what we've been doing.
You can
Which-
put me down as a recipient of the COVID.
I'm sorry.
Yeah, yeah,
Yeah, it's out there. It's not gone away.
yeah. It
how are
bit
you-
me.
How are you feeling?
I'm feeling
You
good.
okay? Are you
Yeah.
okay? We are
Yeah.
finding that folks aren't quite as sick, but we did have 3 hospitalizations with COVID last week or last month, so it's not over. And people still are getting sick. Unfortunately, I haven't had to report a death in a long time.
Are those hospitalizations is Jefferson County?
They're Jefferson
Okay.
County residents, yeah. So we've also had other illnesses. This time of year, we have more foodborne, water, those sorts of people are out and about. So we've had salmonella and some of those sorts of things. So that'll be in the report too. That snapshot really helps us kind of track things, and we're halfway now. So we're looking at where we are for year to date. We have been doing quite a bit of training during the summer for our staff. So we did Public Health Summer Institute the third week in July. The nurses and I did a resilience training related to ACEs, Adverse Childhood Experiences, last week. That was very good and impactful. So and Molly's been teaching some CPR. We've kind of slowed down on what we're teaching as far as mental health kinds of trainings, just summer's harder to do that. However, we have moved our Whitehall clinic into the ambulance barn in Whitehall. And John Janik is very interested in collaborating with us to provide some different types of education out there. They've got kind of conference room in that side. The 3 ambulance bays are in the middle, and then they've got their EMS and community integrated health offices on the other end. But in that end that we're in, there's the conference room, and then there's an office that I guess Tom's gonna go in with his deputies. I'm not sure, but we're supposedly sharing with them. We haven't really seen them in there yet. So there's that really nice conference space to be able to do some meetings and education. And so we're gonna really look at how we can work with them to do some training down there. And I did do a training for Alzheimer's out in Clancy with Mary Williams. In June, the middle of June, we did that. So I guess one of our things is just, it would be lovely to have a space like that here in Boulder in our main office where we had conference room. I know I wasn't able to listen in on Leah's meeting last week. And I know she talked about ARPA funds, and Building 5 was discussed a little bit. So I did talk to her. Molly sat in and took some notes, and then I talked to Leah. So just kind of wondering where we're going with building expansion for the health department. But
Okay, yeah. Yeah, we just got our valuations like yesterday, and we haven't had a chance to process them yet, so once we get an idea how the valuations fit in, our revenues fit in with our budget, then we'll have a better idea what we're gonna do. I don't know how much actual ARPA money we have set aside for you. I know we have what's the other fund, Bob, that we have set aside for Pam?
I don't remember the name of it, Corey. It's got 5 initials to it, but
Local Assistance Fund, LATC funds or whatever, yeah.
880,000. Yeah.
And I don't think that expires. That can be held off, but the actual ARPA funds, I'd have to ask Leah how much ARPA funds she has earmarked.
yeah, I don't want to say for sure. I have something in my mind, but yeah, Leah knows.
So,
So
yeah, we
anyway,
won't know anything until we get this, get the evaluations,
Yeah.
evaluations processed out.
well, it's been really nice to have the building we're in remodeled. I mean, honestly, it's, you know,
Yeah,
it's
it's
clean
nice
and
in
it's
there.
pleasant, but
Mhm.
like last week, twice I had, well, one day I had Connor and Keith come over to interview me about the community health assessment and health plan. They're gonna do a series on it. And I mean, putting two big men in my office isn't very easy. And then I had two visitors from Five Peaks Coalition in Butte come to visit with me. And one of their requests was to have, they want to do some peer support here. Five Peaks includes Butte Silver Bowl, Anaconda Deer Lodge, Beaverhead, us, and Madison. And so we're kind of working with them a lot with some mental health things with that coalition. So they want to put a peer support person over here once a month. They're doing it for each of the 4 small counties.
Okay,
This person is, they have grant funding, but it's where do we put the person? So what we finally worked out is that she would come on the 4th Tuesday every month, which is when Tana's in Whitehall, so she can use Tana's office, which is a more private space in our building. But you know, just those are some of the things that we're dealing with trying to expand services and just not having space to do that
sure.
very easily. And that is with the CHA, with the community health assessment, that is the 2 priority areas that we've really looked at and we're going to focus on in the improvement plan is access to healthcare and quality healthcare. That's one. And I bet you'll never guess what the second one is. It's mental health. Yeah. So, you know, those are the 2 priority areas we're going to be working on. We're working right now with the contractor on that community health improvement plan. I meet with them tomorrow and we'll be sending out an email to our stakeholders so that they can provide some input. Under those priority areas, we'll have some objectives and some strategies that we'll be working on for the next 3 years. So we'll be getting some input from the stakeholders, and not all of those things that we'll be working on are going to be directly under the health department. So we're going to need, you know, some of them to say, yeah, I'd be happy to lead with that strategy, whether it's EMS or whether it's, you know, the healthcare providers, the schools, whoever. But that's kind of what we're looking at now. And the other priority area that was kind of identified, but we didn't choose to make like a 3rd priority area was youth. We did collect a lot of secondary data on youth from the YRBS and the PNA, but we never interviewed the kids. So we didn't have any primary data. We didn't have their voices like we had for everybody else. So we decided not to make youth a 3rd priority area, but to kind of weave them into the other things we were doing. So that is going to involve people like the schools and the daycares and prevention specialists. And so some of those people will probably be taking lead on some of those things.
Good.
So Dan, I did get your voice message.
Okay.
And I've been in and out having some vacation time and training, and I'm way behind on stuff. So my request from you was if you would be willing to maybe look at those priority areas so that we had somebody from the commission maybe involved in that. Actually, all 3 of you could if you wanted to, but your name came up. So I did, that was what the request was, is if you would be willing for us to email you that information and for you to do, it'll be a jot form survey. So it'll just be an electronic survey where you make some choices. There's some multiple choices and then some places where you can type in your own input if you have ideas. So that was what my request was. If you or one of you as commissioners would be willing to look at that information and participate in this part of the improvement plan, so.
Yeah, I'll get with you, okay? I'd like to have a sit down with you on that, because I was wondering a little more in depth on that and stuff, if you could fill me in on just a little bit more of it. But
And the survey is HIPAA compliant, and
okay.
it's, nobody's gonna know who gave what input. That's what we used when we did the survey for the community too, and it works really well because we can get that information in a private way, and that way we feel like we get better responses if people have some, anonymity in how they respond. So
Yeah,
if
sure.
you're willing, I will put you on that email list and you can participate in that feedback. And I appreciate that. So the other thing we're really looking at right now, of course, is getting back to school. Aaron's been in the clinic all summer, and she actually is pretty much done 410s this summer, which she's really liked. And she'll go back to a 5-day schedule once school starts, unless all the schools go to, no Fridays, which several of them, it sounds like, are starting to.
Even the grade schools?
We've got Whitehall Grade School going, no Fridays. They did last year and it was
Oh,
successful.
wow.
Cardwell's gonna go this year. Basin's considering. So the hard thing with no Fridays with littles is daycare, childcare. So I don't know if they'll all end up going that way, but we've had more of them starting to tend to go that way. So, and we're really starting to support Tana in some of the home visiting. I have a brochure. We've been really getting some information out so that she can go in and do some home visiting with some of these new moms. We find that on a prevention level, that if we can get into moms and babies and dads and babies and families when they're little and provide some interventions and some education, that it saves us money and provides for better health in the long run. So we're really looking at how to do that. And she's got a few folks she's visiting now and been reaching out to the healthcare providers to let them know what services she can provide. Jesse's been really busy with a bloodborne pathogen possible exposure the last week from Country Jam. So we've been working on some of that. He's been updating our plans. He said he's never had to process a bloodborne pathogen exposure during the time he's been safety officer, and I haven't during the time I've been public health supervisor. So doing this, we really kind of looked at that plan and how it was working, and there's some tweaks we're going to be making. So you'll see a copy of it, a revised version coming up here pretty quick. And Molly's been teaching some CPR. She's been fishing, so she's a happy camper. She's going fishing again next week. So
Nice.
yeah, we've been trying to get everybody out the door and get some vacations. Molly and I accumulate time a lot faster than everybody else, and so we tend to have a note from Francis every spring saying, use it or lose it, people.
Right, that's right.
So we're trying to use it in a bit more productive way. But that's about us in a nutshell, I think. Do you have any questions for me?
I don't recall, but did you have a summer intern at all this year?
We didn't end up getting a summer intern this year. We had 2 students in the spring, but we never ended up getting an applicant for the summer intern.
Wow.
I know, so we'll push it again next year. Our summer intern from last year's coming to do CPR tomorrow at the clinic, so I know. Yeah, it'd be nice if we could have some kids that,
Yeah.
yeah, I really believe in helping our young people to have some boots on the ground experience, so it's important.
Absolutely.
So unfortunately, no, we didn't get one this year, but
Good. Sounds great. Sounds like you're doing good.
thank
If we
you.
could just double your office space, we'd be in good shape.
That'd be lovely. And I'll fill it up.
Yeah, that's
Something
right.
in there. We'll do something in there.
Yeah.
All
Very good.
right. Well, thank you very much.
Thank you, Pam.
Bob, get feeling better.
I will do, Pam.
Call if I can help you with anything or talk to you about anything.
Yeah, we got to visit about mental health a little bit, but
Okay. All right. I'm thinking COVID. If you need
yeah,
help with COVID, you call me.
I'm missing Jolene's meeting yesterday, so
I got in for part of it, but I was the only nurse in the clinic, so I ended up.
Oh, okay.
I was in, I think I was there about 45 minutes and then I had to do nurse stuff.
Okay.
Yeah. So I
Not much.
I didn't get in on the whole thing. All right, we'll see you guys.
All right, Pam. Thanks a lot.
Thank you. Just let me know when that comes down the pike and then I'll hook up with you.
You know, it'll probably, the email will come out this week.
Oh, will that quick? Okay.
We're gonna meet tomorrow to do the final.